Hello, I'm Dr. Burzin Khan, a prosthodontist and an implantologist, and today I'm going to talk to you about a dental implant, which is a time-tested replacement for your missing teeth. And dental implant provides a good foundation for your oral health as well as for providing good aesthetics. Now, generally when you have a missing tooth, as you see in this case, we will trim down the adjacent teeth to give you a bridge replacement, which would look something like this. Now, the downside of this is that we have to trim down the supporting adjacent teeth, and the life of the bridge would also depend upon the life of these supporting teeth. On the other hand, if I were to replace this missing tooth with an implant, this is how it would look, where the implant is a replica of the tooth root made of either titanium or of zirconia, and then we give a tooth that would go and attach onto this. So you get a fixed permanent replacement which is supported by the jawbone and is independent of the adjacent teeth. Therefore, a very sound for oral function as well as provide a very good emergence, making it look like a natural tooth replacement. Generally, a dental implant would take close to 2 to 3 months for the bone to grow around it and integrate with it for us to be able to give you a good tooth replacement over it. However, with the use of modern technology at Opus Dental Specialities, we provide our patients with the teeth in a same day. What that means to you is that we have the digital technology to plan your implants in a very predictable way using CBCT Diagnosis, which is a 3D diagnosis, whereby we can actually visualize the volume of the bone and whatever is the defect or the adequacy or the inadequacy of the bone, and therefore position the implant in the right way as per how the teeth should emerge over it. Following that, we plan the implants within the software and we do a process of guided bone placement where we use static bone guides. As you see here, this is a bone stent that we fit onto the patient's mouth. Of course, this is an edentulous jaw, but the same way it fits onto the teeth as well, and we can then place in the implant going through these apertures in a very predictable, guided way as we have planned. This minimizes the risk of any problems in the restorative stage where we can have the tooth exactly as we have planned it. Using digital technology, what we also do is we prefabricate the teeth according to the pre-planned implant position and kind of keep it ready before the entire process. Therefore, on the same day, the tooth, if required an extraction, is extracted, an implant placed, and a tooth restored immediately for that particular patient. Of course, there are protocols to be followed in terms of achieving good implant stability before we do that. Now, when we're looking at a full arch restoration, we also provide a solution which is called as an all-on-4 or a fast and fix restoration, where for the full jaw, if we were to replace the teeth in one day, what we do exactly the same way, we plan the implants, we make a guide or a stent like this which fits onto the jaw and place in the implants using this guide, and then we have a prefabricated prosthesis which goes onto those implants. Now, it's called as an all-on-4 because in most cases 4 implants are sufficient to restore the entire arch. Otherwise, we can go for 5 or 6 or 8 implants depending on the need. So guys, imagine walking into the clinic with missing teeth and walking out with a complete full set of teeth where you can eat and chew and smile with confidence. Whether you do it conventionally or you do it digitally, our team at Opus Dental Specialities is experienced and trained to provide you with the best predictable result. Using digital computerized technology that we have at Opus Dental Specialities and my experience of over 30 years with implants, let us help you discover your smiles.